This is a National Diaper Bank Network Minute.
In two states, Tennessee and Delaware, healthy children now can get baby diapers through Medicaid. We're joined by Lacey Giroux of the National Diaper Bank Network to talk about what this means for families. Welcome.
Thank you for having me.
So, Medicaid is essentially health insurance. So, explain to me why health insurance would pay for diapers.
Yeah, so we know that the research that's been conducted around diaper need and its impacts show that diaper need impacts both the health of the child that's experiencing it, but also their mother and their parents. So for children, lack of access to clean diapers can lead to persistent and painful conditions like urinary tract infections and diaper dermatitis. And for mothers, diaper need has been consistently highly correlated with maternal mental health. In one study, more highly correlated than food and housing insecurity. So we also know that having diapers can help reduce healthcare costs and prevent these conditions. So diapers are a medical necessity and are instrumental health-related social needs critical to advancing a child's health and maternal health. And therefore, it should be covered by Medicaid and health insurance when a child or a parent is persistently presenting with these health conditions.
So, it's prevention and
Yeah.
I assume cost savings down the line.
Exactly. Having the diapers has shown, we know from impact studies, shows that there are healthcare savings when you have access to a sufficient amount of diapers.
Are other states looking at using Medicaid to pay for diapers?
Yeah, so since the announcement last year of Tennessee announcing that they would cover diapers under their Medicaid program called TennCare, we saw a lot of activity at the state level, particularly in California and Connecticut. So in Connecticut, a bill was going through the process this year in the legislature, and unfortunately, the bill did not pass as coverage of diapers under Medicaid. But what happened is it was turned into a study. So the state of Connecticut will be studying what covering diapers in Connecticut would look like under Medicaid. And then in California, Assembly Bill 2446 by Assemblywoman Ortega is still alive and actually has progressed through the California legislature. And so that bill has crossed over from the Assembly to the Senate, meaning it just has to get through the Senate and the governor's signature to actually be passed and effective in California. But of course, what we saw with Tennessee and with Delaware is that once something passes, it doesn't mean it's a done deal. It actually has to go through the federal waiver process.
So, speaking of that, I saw the letters that both Tennessee and Delaware received from the feds, giving them the go ahead to do this.
Right.
And I noted how much research that I'd been looking at for years that NDBN had either spearheaded or participated in was cited in those letters. Talk a little bit about the importance of research in driving policy change.
Yeah, so research is critical for policy change. Without it, it's hard to justify and truly explain the problem and its impacts. With research, we're able to point to the magnitude of the issue. We know nearly 1 in 2 U.S. families are experiencing diaper need, and we're able to explain the impacts that diaper need has on health, well-being, and economic mobility of children and families. And so through the research, we know that diaper need deeply impacts a child's health, a mother's health, parent stress levels, and also access to work and to school and opportunities beyond that. And without that research, it's really hard to explain to legislators why this is so important and what needs to change in order to alleviate this issue.
You mentioned that 1 in 2 number experiencing diaper need, and we saw that in the NDBN Diaper Check 2023 and now in the NDBN Diaper Check 2024. That's a huge number.
Yeah.
So what does that say about the need for more policy change as opposed to just relying on nonprofits who are doing heroic work to address it, but given the scale of what's happening?
Yeah, I know. We know with that scale, diaper need is a public health crisis. And so we are seeing that the nonprofits have consistently stepped up. They're addressing the need in their communities and increase in demand for their services. But they rely on the support of foundations and donations that come from private entities or individuals. And so there are some diaper banks across the country that get support from the government right now. But it's really going to take all of these mechanisms, the work that's happening on the ground, the federal investment and the state investment in order to address the extreme need for diapers in the US. And covering diapers through Medicaid is certainly going to help alleviate this issue in tandem with all this work that's happening on the ground.
Thank you. To learn more about diaper need and how you can advocate to end it, visit nationaldiaperbanknetwork.org.